with the most very small risk, and so I have to maybe go with a very non-aggressive treatment, or maybe they just don't want any downtime to speak of. So, but at the end of the day, I don't sell fractional CO2. I don't sell Mixto. What I sell is an improvement in the face. And if that means, liposuction in the neck, that's what I'm going to do. If it's telling the patient no for what their budget is, it sounds like, the best thing you can have is an upper eyelid blepharoplasty. That's what I'm going to do. Now, it turns out that this is a sweet spot for facial aesthetics. Patients very, very at a high rate will accept the cost, the downtime, and the results with a fractional CO2 resurfacing. We're oftentimes combining it with liposuction of the neck. We're oftentimes combining it with minimal incision work on the face, whether it's a blepharoplasty or a small incision facelift or an anguloplasty to improve the smile, something incisional like that. We're always combining it with facial fillers, and we like to use the fillers that have the highest margins. So we probably use Juvederm on every single patient that we do a fractional CO2 on. We probably have our best margins on Artefill by far, and so we like to volumize the face because you really can't get a result. I'm pointing at this particular patient right here. You can't get this type of result with laser alone. It's not labeled, but clearly this patient had a little bit of volume in her cheeks as well. And guess what? It's a perfect time to do it while you're doing your laser resurfacing. Because the patient is numb, they're under their block, they're comfortable, and so we like to sell them a result. So that's usually a package of fractional CO2 resurfacing along with their volume that they absolutely have to have. Very, very infrequently will patients just tell us to do the laser and come back and do volume later. We'll find, even if we have to give them the volume, we'll let them pay their, $5,000 or $6,000 for their fractional CO2 treatment, and it's our reputation. So if we have to give them some of the volume, we give it to them. I think that's just what you have to do to take care of patients. Okay, so let's see. There we go. Perfect. Okay, so this is me, my treatment plan, Dr. Laurence. And by the way, my email address, if you want to write it down, just in case you have a private question that you can't or don't want to, you kind of want to say, what's the real scoop on this? Do you really, were those mixed scoop guys paying you off? And the answer is no, they're not. I really love doing this. And so this is just something that I like to do, and I'm really looking forward to doing another one of these down the road. But if you have a question for me, my email address is superdoc, like Superman, but superdoc, D-O-C-G, superdoc-G @gmail.com. If anybody can get that, just IM me, and I'll tell you what it is again. So here's what I do commonly. This is the way we approach, and I'll show you some of our photos and show you the results that we're usually trying to get. We don't really like to do treatments that are minimal. We like to, talk the patient into doing something that's going to really address all of their issues. Sometimes we'll do a partial face treatment, like a perioral or a periorbital treatment. I'll show you one of those in a minute. One of my staff had one of those yesterday. But we usually are doing full face treatments, and we're doing 3 passes. That's the highest that most fractional CO2 laser boxes will go. Mixto is no exception to that. There's some reasons why I like Mixto better than my previous fractional CO2 laser. I've already talked about the continuous wave versus the ultra pulse for the super pulse. I also can tell you that it allows you to make every single change that you need to make to do whatever you want to do. I don't really understand how I could, in 10 years, I could still be using this laser and be doing really, really well with it. I'll probably be combining it with other energy technologies at that time, but I don't think we can get any better at what this technology is delivering by itself. There's not going to be a single technology that can overtake what we can do with this. So think of it this way: 30 is the highest, and when you have it on the highest energy, the highest fluence, you need to be cautious about how much coverage you're doing. So we talked about it going from all the way from 5 to 40%. So if you're using 30 watts, you could use 15 if you wanted to, or we usually combine it with other passes. So we use it at 10% by rule. We do exceptions, but usually when we have it on 30 watts, we're at 10%. We leave, again by rule, the pulse width at 2,500 microseconds, which is 2.5 milliseconds, which is in that technology it's an 8. I guess some egghead physicists decided to put that in there that way. But we use an 8 index for our pulse width for almost everything we do. Sometimes we're trying to get a little bit deeper, and we'll change it to a 7i, which is 3,500 instead of 2,500, and for pulse width, and to get a little bit deeper. But generally, we like to stick with the same energy. A 20 watt, 20% is our workhorse. We don't just put a whole bunch of passes at 20/20 because we usually try to be a little bit thoughtful about how we're covering the face. When we're using a 10 watt, we're pretty tight. Usually we're going 40% when we're doing 10 watts. That's more of a resurfacing thing. Now the only place on the face, and that's what this is down here, by the way, standard 8. That should be a lowercase I for index duration. That's what I use standardly. What I was going to say is the only area I want you to be somewhat cautious about is under the eye. Under the eye, the tissue contraction that you get is so good and so effective that you can actually cause an extropion. I've never seen one stay, but as I'm doing the treatment, you can see that skin tighten up as you go. Pretty impressive. And so I'm always real thoughtful. I do a snap test. I look at that area, and as long as the tissue, as long as they don't already have a lower eyelid that pulls away, but they're a little bit of an extropion already, or if they have a lot of scleral show, I'm going to be a little bit more cautious. But otherwise, this is an interesting side note. We all know that the skin on certain areas of the face, like perioral, is several orders of magnitude thicker than other areas. For instance, the thinnest area on the face, which would be periorbital. But at the end of the day, for some reason, you can still use incredibly high energy on these areas where the skin is thin. I'm only cautious in the really old patients that have paper-thin skin. I'm going to be more cautious in those. But just about everybody else, you can really be aggressive everywhere on the face, including we use some wildly aggressive settings on the upper eyelids to be able to cause redundant skin to contract. And we have never we haven't even had a patient with delayed healings. They're very predictable how they heal. So that should give you a lot of excitement. I want always be cautious. Start a little bit with less energies until you get comfortable. But we use pretty significant energies here. And Alan from lasering will probably let you know that when you get your laser, generally you can come out and do training with a physician who's as experienced as me, if not more. We also, of course, are open to doing some advanced training with patients. And so this is all things that you can get going on. This is just pointing out that they've got one of my photos listed here where Mixto just cleaned up over the last couple of years at the aesthetic show. Really, really neat, really kind of compliments to them for their non-surgical win that they have this year with my photos and last year with another physician's photos. So this was the one that I had entered. So this patient does have volume. I did initially do a peel on